Have you ever felt off, like something's just not quite right, but you can't figure out why? It could be something simple like stress, lack of sleep, or even your diet. But here's the thing. A lot of times these feelings could be linked to something even more basic: vitamin deficiencies. You might not even realize it, but certain vitamin deficiencies can lead to subtle changes in your body that you shouldn't ignore. The problem is, many of these signs are pretty easy to overlook. You might chalk them up to tiredness or just normal aging. But if you're noticing any of these 7 hidden signs of vitamin deficiencies, it might be time to take a closer look at what's going on inside your body. Today, we'll go through these signs one by one so you can figure out if you might need a little vitamin boost. Let's get into it. Unexplained fatigue. You know that feeling when you wake up in the morning, but you're still exhausted? Or maybe you feel tired no matter how much sleep you get? It's one of the most common complaints people have, and it can be more than just stress or lack of sleep. If you've been feeling constantly drained, it might be a sign that you're not getting enough of the right vitamins. 2 key vitamins linked to fatigue are vitamin B12 and vitamin D. Vitamin B12 helps your body produce red blood cells, which carry oxygen throughout your body. When you're deficient in B12, your body can't deliver oxygen as efficiently, leaving you feeling tired. Vitamin D, on the other hand, is known for its role in boosting the immune system, but it also plays a part in energy production. Low vitamin D levels have been linked to feelings of tiredness, depression, and even muscle weakness. If you've been feeling unusually fatigued for no reason, it could be time to check your B12 and D levels. If your fatigue doesn't improve with sleep or a balanced diet, it's worth getting your vitamin levels checked. Please like the video and subscribe to our channel so you don't miss essential tips for your health and wellness. Brittle nails and hair loss. Have you noticed that your nails are suddenly more brittle? Or maybe your hair is falling out more than usual? It could be a sign of a vitamin deficiency, specifically biotin, zinc, or vitamin D. Biotin, also known as vitamin B7, is essential for healthy hair and nail growth. A lack of biotin can lead to thinning hair, weak nails, or even hair loss. Zinc also plays a big role in hair growth, and a deficiency can result in hair thinning or even hair loss. Vitamin D is vital for healthy skin, and low levels of this vitamin can lead to dry, brittle hair and nails that break easily. If you've noticed changes in your hair or nails, it might be time to look at your diet and see if you're missing some of these key nutrients. To help your hair and nails, try eating biotin-rich foods like eggs, nuts, and seeds, along with zinc-rich foods like oysters, pumpkin seeds, and beans. For vitamin D, consider getting outside in the sunlight or eating vitamin D-rich foods like salmon and fortified milk. Muscle weakness or cramps. Have you been getting frequent muscle cramps, especially at night? Or maybe your muscles feel weaker than usual, even when you're doing basic activities. This could point to a deficiency in magnesium, potassium, or vitamin D. Vitamin D is important for muscle function, and a deficiency can lead to muscle weakness and pain. Magnesium, on the other hand, helps your muscles relax, and a lack of it can cause cramps, spasms, or twitches. Potassium is another essential nutrient for muscle health, and low potassium levels can lead to muscle weakness or cramps. If you've been dealing with unexplained muscle issues, a vitamin or mineral deficiency could be the cause. To keep your muscles strong and avoid cramps, make sure you're eating enough magnesium, found in nuts, seeds, and leafy greens, potassium, found in bananas, potatoes, and spinach, and vitamin D, which you can get from sun exposure and fatty fish. Pale skin or gums. You've probably heard that pale skin can indicate health issues like anemia, but did you know that it could also be related to vitamin deficiencies? A lack of vitamin B12, folate, or iron can cause pale or sallow skin. Vitamin B12 is essential for red blood cell production, and without enough of it, your body can't carry oxygen as efficiently, leaving your skin looking pale. Folate, which is another B vitamin, plays a similar role in red blood cell production. Iron, while not technically a vitamin, is a mineral that is crucial for oxygen transport. If you're low on iron, you might notice pale skin or even pale gums. If your skin or gums have been looking off, you might want to check your B12, folate, and iron levels. Boost your vitamin B12 by eating eggs, dairy, or fortified cereals, and iron by including lean meats, beans, and spinach in your diet. Mood swings or irritability. Have you been feeling unusually moody, anxious, or irritable lately? It could be linked to a vitamin D or B6 deficiency. Both of these vitamins have a direct effect on your mood. Vitamin D, which we've mentioned before, helps regulate your mood and emotional well-being. Studies have shown that low levels of vitamin D are associated with a higher risk of depression and anxiety. Vitamin B6 also plays a role in mood regulation because it helps produce serotonin, the feel-good chemical in your brain. A deficiency in B6 can lead to feelings of irritability, sadness, or even depression. If you've been feeling more on edge than usual, it might not just be stress, it could be a lack of vitamins. If your mood has been low, try increasing your intake of vitamin D by getting more sunlight or eating vitamin D-rich foods like egg yolks, fatty fish, and fortified foods. For vitamin B6, you can eat foods like chicken, bananas, potatoes, and chickpeas. Poor wound healing. Have you noticed that cuts, scrapes, or bruises are taking longer than usual to heal? This could be a sign that you're not getting enough vitamin C. Vitamin C is essential for collagen production, which is key for tissue repair and wound healing. Without enough vitamin C, your body might struggle to repair damaged tissues properly, leading to slower healing. Vitamin C also acts as an antioxidant, helping to reduce inflammation and fight infections. So if you've been struggling with slow-healing wounds, it could be time to check if you're getting enough vitamin C. To get more vitamin C, include citrus fruits like oranges and grapefruits, or other vitamin C-rich foods like bell peppers, strawberries, and broccoli in your diet. Constant cold or respiratory infections. If you find that you're constantly battling colds or respiratory infections, it might be a sign that your immune system isn't functioning properly due to a vitamin D deficiency. Vitamin D plays a crucial role in regulating your immune system, and without enough of it, your body may struggle to fight off infections. In fact, research shows that people with low levels of vitamin D are more prone to illnesses like the flu, colds, and respiratory infections. So if you're finding yourself sick all the time, it might be time to focus on boosting your vitamin D levels. You can get vitamin D from sunlight, fatty fish, and fortified foods. To support your immune system, try spending some time in the sun, eating vitamin D-rich foods, or talking to your doctor about supplements if necessary. And there you have it, 7 hidden signs of vitamin deficiencies that you shouldn't ignore. It's easy to overlook these signs, especially since they can be subtle, but they can have a big impact on your overall health. If you've been noticing any of these symptoms, it's a good idea to talk to your doctor or nutritionist to get your vitamin levels checked. Remember, taking care of your body starts with making sure it gets the nutrients it needs to thrive. If you found this video helpful, don't forget to hit that like button, share it with friends or family who might need this info, and subscribe for more health tips. Stay healthy, and I'll see you in the next video.